Go right ahead.
Hi, Dr. Drew. It's Jewel. I recently was dealing with a friend whose son was going through some hard times with drug addiction, and I had heard you mention somewhere, or I thought you mentioned, that if a child's parent has drug abuse in their history, that they're genetically disposed. So when they call drug addiction a disease, I'm trying to understand what that means. Is it a disease because it's genetically inherited?
Well, there is a genetic component. About 60% of addiction is accounted for on the basis of genetics alone. And before you decide whether something is or is not a disease, everyone has opinions. Is addiction a disease or not? Let's define what disease is, right? Before you know whether something's a chair, you have to know what a chair is. Okay, so disease. Here is a definition of disease. It's a complex relationship between the genetics of the individual and the environment that results in abnormal biology, pathophysiology we call that, which is reflected in signs and symptoms that follow a predictable pattern and have a predictable response to treatment. So the genetic environment results in abnormal biology that has a predictable pattern to it. Addiction categorically fits that. And as you ask, even the genetics, and in most cases the probability of getting that genetic potential is about 50%, but genes are not destiny. Just because you have the genes doesn't mean you're going to get the disease. There's usually an environmental interaction as well that triggers this genetic potential.